Hi everyone. Thank you for taking the time to express some interest in some of our fancy new technology here at Langley Hospital. My name is Dr. Mitra Maharaj. I'm the Chief of Surgery here and Langley's only otolaryngologist, which is an ear, nose, and throat surgeon. And I'm very excited to show you one of the new acquisitions we have recently been very fortunate to receive from the Foundation, and that is a new Olympus video tower. This video tower is of the latest technology. It is high definition. It has a number of components that you can see here, and all of these components together are valued in the neighborhood of about $100,000. So this is very expensive equipment. It is very technical and is specifically designed for the sorts of procedures that we will be using it for here at Langley. The screen, as you can see, is a nice big flat screen. It's highly mobile and adjustable so that our surgeons and assistants can get the best possible view of the screen throughout their surgeries. It has a component here that's called an insufflator. That means it blows air, specifically carbon dioxide, which is used during laparoscopic surgeries done through telescopes using small instruments, so that we don't need to make big incisions in patients in order to access the critical areas and do very specific work. So that means patients get better more quickly, they get out of hospital more quickly, they get back to their lives, their families much more quickly with fewer complications. This next component down is called the processor. It's the part into which this camera that I'm holding plugs in, and this is like the computer you have at home. It takes all of the digital information, turns it into this beautiful image that is then displayed in high definition on the screen. The next component down is the light source. This is a very specific, high quality, fully adjustable light source. The computer is constantly calculating details about the image that it receives and adjusting the light accordingly. It's like having your own light person constantly adjusting the light in the room so that exactly what you're interested in seeing is shown in perfect display. The other components further down here include another air source that is used for specific instruments such as bronchoscopes and esophagoscopes. So when we put in TV cameras into small spaces, it's important that those spaces not collapse, or else we wouldn't be able to see. So these components introduce air through the scope so that the area that we're looking in is well inflated, it's nice and open, so then the light from the light source can get in, the camera gives this beautiful image, so we can see exactly what we're doing. And finally, at the bottom, we have a digital dye sublimation printer. So this provides very high quality pictures for documenting what we do. So when we see something using all of this equipment, it's very important that we document it, that we keep good records, not only to educate patients as to what happened to them, but to keep track of things so that we can understand what may be changing over time for a given individual. This device, of course, also has the latest in digital image capture technology. So with the press of a button up here on the camera, what I'm seeing on the screen is immediately captured just as you would with a digital camera, so that it can be made part of the patient's electronic medical record. So here at Langley, as a community hospital, we serve a wide variety of patients. We do lots of different procedures, from those in my area of expertise, such as endoscopic sinus surgery, to those in the expertise of some of my colleagues, including general surgery, urology, gynecology, all of which is now being increasingly done with devices such as this. So because of the generous donations that you have provided, we can acquire this sort of equipment and really bring to our community the best and the latest in minimally invasive surgery. Surgery that's done with the least damage to normal healthy tissue, so that we can very deliberately and specifically address the area of disease without causing any harm to surrounding areas. At the end of the day, this sort of thing is only available through the sorts of donations that the P.A. Woodward Foundation, the Langley Rotary Central Club has provided, and all of the members really at the Denim and Diamonds Gala this year have supported us in order to acquire this sort of equipment. this type of device really makes the difference for patients every day in terms of whether they get the best quality care or a kind of care that they would not be so keen to receive. So we're so grateful that this sort of equipment is being provided to us so that every patient who comes through our doors leaves having had the best possible care that we can provide. Thank you all.